The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. Good day to you, or good evening, depending on the time of day you are watching this episode of TMD Demystified. I am Tony Urbanic. Welcome. Today, I am going to continue on with the topic. The title of this topic is Why Has No One Ever Told Me About This? Why has no one ever told me about this? Referring to the Urbanic device and protocol, what I have learned and what I have to teach and what I have experienced along with my colleagues who use the Urbanic device and protocol now throughout the United States and maybe someday beyond the United States of America. This is a huge problem. The issue of TMD was a huge problem to figure out. As it turns out, it wasn't complicated. Knowing a little bit about cell biology and a little bit about anatomy, a little bit about gross anatomy, a little bit about histology, a little bit about orthopedic surgery, figuring out what was going on, actually happening with TMD, and why the whole concept of treating TMD, TMJ was literally considered smoke and mirrors for the past 50, 60, 70 years. And I don't say that slightly, and I don't say it without a considerable amount of consideration on the effects it might have on others who use smoke and mirrors to treat TMD. But it was figured out. But the real problem is that the word is not out enough. There are not enough people who are aware that there is a simple solution to this problem. The misunderstanding has not been understood by only a small percentage of the medical dental establishment. Therefore, we experience on a day-to-day basis patients presenting to our practice, which sees a huge volume now of TMD patients, and a very common question from patients is, how come nobody ever told me about this, after they have suffered years, sometimes decades of symptoms and seen multiple doctors to try to solve the symptoms. And this is the practicality of it. This is what I'm going to talk about, and I've discussed it now with two already separate entities who have partial responsibility why the patients ask that question. How come nobody ever told me about this? And the first one that I talked about 2 weeks ago was insurance companies, their part to play in this, and their responsibility of why the patients can have the problem for decades and not have resolution or even any understanding from the doctors. And the next that I discussed was next was teaching institutions. And today we're going to discuss hospitals and large corporate health entities, large corporate health groups, which would include hospitals, which include large groups of medical doctors and doctor specialists, and their part to play into why patients can continually ask, how come nobody ever told me about this? Because, as I said, these patients circulate into the hospital system and large medical groups expecting to find solutions to the problem and don't. So it's a matter of education. It's a matter of awareness. I will discuss our solution to that awareness issue a little later on. But right now, I'd like to just define the problem as it applies to hospitals and large medical groups, because here in Middle Tennessee, we have plenty of both. In Middle Tennessee, we're the home of healthcare is one of the prime movers within the economic system within Nashville and Middle Tennessee. We are home to Hospital Corporation of America. We have 3 large hospital groups in Middle Tennessee. Ascension, which is a network of Catholic hospitals. We have Vanderbilt University, which has multiple facilities throughout Middle Tennessee. And again, we have HCA hospital system here in Middle Tennessee. And each of those, I've experienced the same issues with patients entering those hospitals, hospital groups. And then there are large medical groups here in Middle Tennessee also that have already hundreds of physicians and physician specialists who network amongst each other to solve medical issues and to treat medical problems. Well, first of all, TMD is a medical problem. It is not a dental problem. We don't have to adjust teeth to fix the problem. We're not doing anything inside the mouth to fix the problem. We are totally taking the load off the jaw joints sufficiently long enough period of time that the inflammation decreases. When the inflammation decreases, all the symptoms diminish. If and when I did over 2,000 temporomandibular joint surgeries, it was always covered on the medical side, not the dental side of insurance. TMD is not covered under dental. TMD, if it's going to be covered, it's going to be covered under medical. It's a medical issue. So therefore, hospitals and large medical groups have a certain responsibility to diagnose it correctly, and they do a great job at other kinds of issues, other kinds of diagnoses. But on the issue of temporomandibular joint problems, frankly, in my opinion, they are major failures. So let's just use an example, and these are the most common examples that happen all the time. I mean, on a daily basis in my discussions and consultations with patients, this is what I hear, and this is why I'm here to discuss it. A patient has one or more of the following symptoms, and we'll use headaches as the prime example, but they can have any one of the following symptoms, and they end up in the emergency room, emergency department of a large hospital. And those symptoms can be acute or a history of frequent and recurring headaches, ear pain, neck pain, jaw pain, upper back and shoulder pain, arm, hand, finger tingling and numbness, even chest pain, tinnitus, ringing in the ears, subjective hearing loss of hearing, and vertigo. And a patient can show up in an emergency department with any one of those symptoms, but primarily, in my experience, they will show up because they have severe headaches. I mean, a killer headache. And they don't know what to do about it, and it's 2:00 in the morning, and they end up in the emergency department. Now, what happens in the emergency department is they get in line and eventually are seen by a physician who takes a brief history about the headache, history of medications, history of headaches, and then will possibly get an MRI and a CT scan, do some blood work, MRI and CT scan of the head, looking for an internal bleed, evidence of a stroke, evidence of a tumor, or they'll do blood work looking for any inappropriate issue there. And then once all that is done and comes back as normal, the emergency room doctor will just shake his head and say, I see no reason why you should be having an acute headache to this degree. Will likely give the patient some kind of pain medication and say it's probably best that you check in with your PCP or find a doctor that you can follow up with this. And then that is 100% of the time, and the emergency department, 100% of the time, what happens to a patient who enters with acute headaches. I have never, ever had an emergency room, never, ever, out of thousands of patients referred here, had an emergency room doctor press on the jaw joints and say, oh, your joints are inflamed, your joints hurt. This is likely TMD. Never has that happened out of the thousands of people. We get a lot of referrals from ENT doctors because they are enlightened now. They are aware. We have made them aware. But the emergency room doctors, emergency room physicians, never, ever. So it's just overlooked. And that's not the purpose of an emergency room doctor, actually, to give them a little slack. That's not their purpose. They are not aware of TMD. They don't know how to rule it out rapidly or rule it in rapidly. And therefore, it's not on their radar screen. If it isn't on their radar screen, they're not going to even attempt it. Happens all the time. And it happens also in a similar way when patients go to a large medical group. Now, a large medical group can be defined as the Vanderbilt group, who have literally hundreds and hundreds of dentists and specialists scattered throughout Middle Tennessee, of all varieties. And a patient enters the Vanderbilt system and with any one of those prior symptoms that I mentioned, and can be shuttled between specialists and neurologist and ENT doctor and orthopedic surgeon, and multiple X-rays, MRIs, CT scans taken, histories taken. And I have had patients in the Vanderbilt system that have been shuttled around for years, when any one of those doctors could have suspected TMD, pressed on the joint from the open to the closed position, elicited pain, and was able to tell a patient, well, your joints are inflamed. This is likely TMD. Well, I literally have had hundreds here in Middle Tennessee now for the past 46 years. I've had hundreds of people in the Vanderbilt system that have shuttled around from doctor to doctor, placed on multiple kinds of medications from neurologists or ENT doctors, or PCPs, when they actually had TMD. It is just so common. So why can patients say, how come no one ever told me about this? Is because the large systems, the large hospital systems, the emergency departments, and the mechanisms within large medical groups are not set up or aware enough to look at TMD unless they've been made aware. Their purpose is to treat and rule out significant disease, which TMD is a significant disease. You cannot ignore that having frequent and recurring headaches, earaches, jaw pain, neck pain, tinnitus, subjective hearing loss, vertigo, upper back and shoulder pain, arm, hand, finger tingling and numbness, and various kinds of locking, you can't say that's not a significant disease. It is a very common disease too. It's significant in its symptoms, and it's very significant because of how many patients are affected by temporomandibular joint problems throughout the United States. And my contention is that it approaches 45% when you include all of the tinnitus, subjective hearing loss, and vertigo, upper back and shoulder pain that is misdiagnosed as other problems, primarily cervical problems. We've had patients who have had neck surgery of one kind or another, when actually their shoulder pain and their neck pain was directly responsible from inflammation within the temporomandibular joint. I've seen it multiple times. Fact. So it's all about making the other doctors in the medical side of our healthcare system well aware, because they actually see the vast majority of patients with these symptoms. Now, obviously, I'm not trying to make the case that temporomandibular joint inflammation is the only cause of headaches, earaches, shoulder pain, etc. That is not what I'm saying. That is not the fact. But because it is so common and so frequent, the incidence of temporomandibular joint disease approaches 45% when you include all those symptoms together. The studies that you read that say the incidence of TMD is between 15 and 30% or 15 and 25% really only address the localized symptoms. When I read the studies, and they don't include the other symptoms that would entail the less known symptoms. They're just talking about earaches and jaw pain that patients can point to that it hurts here, or inability to open, jaw functional problems. That accounts for 15 to 25% of the patients. But when you include all those other symptoms, this is a huge, huge problem. And patients, primarily females, 95% of people with TMD are females, because estrogen exacerbates inflammation, are going untreated, undiagnosed throughout the United States all the time, and these symptoms ruin their life. That is a fact. So, why do hospitals and large groups of doctors not know about this? Because they weren't trained in it. That it's not on their radar screen. They're there to address significant problems and rule out life-threatening problems for sure in the emergency department, and to help patients with chronic illnesses using the methods that they know how to use, which when it comes, either in the medical establishments, you either do surgery or you use drugs. A little bit of physical therapy from the physical therapists. But in the medical establishment, you use medication, you use drugs, or you use surgery, or a combination of both. And this device is neither. Now, as a retired surgeon, I'm very obviously familiar with the surgical interventions, which I stopped doing 12 years ago because of the relative ineffectiveness of surgery. But the medical establishment, the only methods that they have are surgery and medications. And therefore, if you own a hammer, everything looks like a nail. And so if you're a neurologist and someone comes in with headaches, it's not on your radar screen, and actually not to your economic benefit to be looking for this. We see that all the time, especially with neurologists. Now, what do you do about this? We have successfully created a system that, at least in our neighborhood, in our area, is handling the problem on a step-by-step, doctor-by-doctor basis. We're making doctors aware. When I say doctors, I mean physicians, physician's assistant, nurse practitioners, physician's assistants who man the immediate care clinics, which is a huge number of patients present to those immediate care clinics with headache, earache, and various upper body pains. Making those practitioners aware of how to properly diagnose and recognize TMD, recognize the symptoms, which are nothing more than red flags, and making the diagnosis by having multiple symptoms with inflamed joints, hot joints, and you've made the diagnosis. Using that system that we use, and I've discussed in other episodes, snail mail letter snail mail letters going out to the doctors who misdiagnosed the patient and informing the doctor that their patient had been in the practice for whatever length of time, 3 weeks, 6 weeks, 2 months, with certain symptoms, and that 70% of the symptoms or 90% of the symptoms or 50% of the symptoms at whatever point in time are diminished or gone. And within a short period of time, those doctors are aware, they're enlightened, and they begin recognizing how to diagnose TMD properly, and they start sending patients in. Because of that, we have in excess of 400 physicians within Middle Tennessee now who send our practice temporomandibular joint patients who are primarily already diagnosed, or at least highly suspicious. And rarely do we see a patient who does not have TMD that is sent in by a physician, physician's assistant, nurse practitioner, convenient care clinic. Rarely one of those entities send us a patient who does not have TMD. Easy to diagnose. So that is why, that answers the question partially, why has no one ever told me about this? Because that's a question we get so frequently. In parallel to that, we frequently hear the statement, the only thing that I regret is not knowing about this before. And both of those, the question and that statement, are most frequently heard, usually within 3 weeks to 3 months, 2 to 3 months after beginning treatment. And they realize that they have seen 2, 4, 6, 8, 10 or more doctors throughout a length of time that have been misdiagnosed, mistreated, or misdirected and placed on drugs. We have several patients, as I already said, who've had neck surgery. I've had several patients who have been diagnosed with carpal tunnel syndrome and had surgery for carpal tunnel and continued to have numbness of the fingers, which was generated by inflammation within the joint, which created tightness of the scalene muscles on the side of the neck, which squeezed the brachial plexus, causing arm, hand, finger tingling and numbness, which was misdiagnosed as carpal tunnel syndrome. I've had multiple patients who have had that surgery to no avail. And I've talked about that a little bit before, but it all comes down to how come nobody ever told me about this before? It's because the physicians and physician types in the healthcare system are not aware. And we are making great progress here in Middle Tennessee of making that group aware and have done it successfully. That's the message for today. We're going to continue on with this series. The next group that I'm going to be talking about that's partially responsible, why patients can actually say that. The patient that struck me, I speak on often, but she was absolutely certain that she had seen over a period of 20 years, 150 different practitioners trying to explain, and she had all of the symptoms. 150 different practitioners trying to explain how and why and how to treat this plethora of diverse symptoms over a period of 30 years. That's extreme. That's way extreme. But she said, I swear it's been that many doctors that I've seen. But the average is probably 5 to 7. Sometimes I'm tired of asking anymore. I don't ask as often as how many doctors have you seen for these symptoms. I used to ask all the time. I don't bother anymore. I already know the numbers. It's a great number of doctors. So if you, in your neighborhood, in your geographic area, would like to learn how to use the Urbanic device and protocol, learn how to make other doctors aware of it using the proprietary system that we use, we're happy to teach. That's why I do these episodes on Dental Town, why we do this podcast, to teach and to make you, the dentist, aware that it's a simple treatment, that you can do it to the benefit of your patients for sure, the benefit of your practice for sure. It's a great practice builder. If you'd like to learn how to do this, the quickest way is to review our website, www.urbanictmj.com. I'm open for communication at Tony@tmj.services. Let me get that right. Tony@tmj services.com.net. Let me do it again. Tony@tmjservices.net. Our Director of Education and Marketing, Dr. Naomi Williams, can be reached at naomi@tmjservices.net. Look forward to talking with you. Look forward to answering your questions. Look forward to anything you'd like to say or criticize, for sure. But now you know another group that actually has partial responsibility for the patients who are figuratively and actually abused by our system. Next time, we're going to talk about venture capitalists. Venture capitalists have a large part to play on the development of our healthcare system. I was not aware of that until relatively recently within the past few years. But as I got deeper and deeper into developing this company, I became aware of how the healthcare system is capitalized, where the money comes from, how it is used. And venture capitalists and capitalists in general have a large part to play in answering the question, how come nobody ever told me about this? And we'll discuss that next time. So for today, I appreciate your viewing this. I appreciate your interest, and I wish you a successful week. I look forward to speaking with you on the next issue of TMD Demystified.